Thank you all, folks. We'll go ahead and call the Health Subcommittee of Appropriations to order. And you all have your tracking sheets, and what we'll be discussing are just the differences from the governor's recommendation. And I'm going to go through those, and we'll start with that now. 17.1.7, you'll notice is $170,000 saving. This is where the Navigant contract has been completed, and that was a savings that's been able to be captured since that's completed. 17.2.3, this provides funds for operations for the dental board, and if you'll look 17.3.3, same item for the pharmacy board. Those two boards are working together, and there's a $247,000 add that's split between those two boards because they're using some of the same help. And this is to allow them to do the processing of these applications that they have, and so many are having to be almost hand done because having to prove proof of citizenship that first time and some things like that. So they're in need of that money. 17.4.5, this is a $500,000 add. This is to provide for one integrated behavioral health center and one community health center there. So that's what that's for, is to provide startup funds for those two facilities. 17.4.6, this is the increased funding for the AHEC housing resources for medical students who do their 6 weeks rural primary care rotation. This $300,000 will increase their capacity by some 50 beds for over 400 rotations over those period of time. 17.4.7, this is a $50,000 add. This is for the Southeastern Firefighters Burn Foundation there in the Augusta area. 17.4.6, this is to increase contract funds through the Easter Seals Champions for Children for some of those children who do not qualify for the Katie Beckett waiver. They'll take this money and leverage this with their others, and they do a good job meeting the needs of some of those children. One of the things that will be new, if you look 17.5.3, if you'll remember, the legislation was passed in 2003 to provide licensure for the adult daycare center facility licensure program. This fund will get that started at $321,000. There are approximately 200 centers in the state. They would be licensed, and and that's what that is to start that program that we passed the legislation back in 2003. Under the medically aged, blind, and disabled section, the 17.7.1, there's an add there of $566,000. This is to utilize enhanced federal participation rate and increase funds to increase the Medicaid reimbursement rate for alternative living services and personal support services and case managers. And that's that CCSP and SOURCE program. And that's what that is, using those dollars and drawing down federal dollars. Just want to point out to you 17.7.2, the governor added this for us. This is something we've always been interested in trying to do. This was the 25 additional independent care waiver slots that have been added, so I know there's some interest in that. 17.7.7, this item, like a couple of others, will be appearing in 3 different programs. This is to reduce funds to recognize savings due to the increased utilization of the PARIS system. That's the Public Assistance Reporting Information System. This will be used to help determine Medicaid eligibility, and if someone is not eligible, if they're eligible for some other support or maybe even Medicare benefits or VA benefits. So that's where we're coming from with that. There's a $2,000 savings there in that. And you'll see this also now in low income and in peach care. The 17.7.11, this is the reduced funds to reflect the hospital cost settlements. This is just a truing up of the numbers between the community health and the hospitals. There again, this will appear in all 3 programs, ABD, LIM, as well as peach care. That's 2.583. 17.7.12, this is to reduce funds to reflect savings through patient-centered outcome incentives for case care and disease management programs. This is a statewide voluntary case management program that grew out of the Navigant study. This will pertain only to the ABD population, and that request for proposal is open now, and that's where that savings will come from there. 17.8.7, increase funds for growth in Medicaid based on increase to reflect the planning for the healthy babies. And if you will keep in mind there, we're reducing that from the 12.2 to the 8.6, but then on the further down on 17.8.14, you'll see that money. This is just where we're breaking that out to show legislative intent on that, and all it is it's being reduced here, but it's being added in a later spot. 17.8.8, there again, this is the savings recognized from the Paris system that I mentioned to you earlier. $17.8.14, there's the line that I told you about, the planning for the healthy babies, the 3.6 that we just located and broke that out separately there. 17.8.15 is a savings of $1.2 million, and this is the revision of the supplemental drug rebate program from the CMO claims. If you look 17.8.16, there's a reduction there of $225,000 for the Georgia Center for Oncology Research and Education Core. That's removed, and we're going to see that again over in public health because that's tobacco money, so we're moving it out of here, putting it in public health, and we'll get to that in just a minute. 17.8.17, there again, this is just a truing up of the amount of the hospital cost settlements that I mentioned to you earlier. Under Peach Care, 17.9.14, this also is a savings that's recognized from the utilization of the Paris system that we talked about earlier. And then 17.9.8, there again, that's the hospital cost settlements truing up under the three programs that we discussed earlier. Under state health benefits, if you look at 17.10.4, there's a reduction there, and this is part of the governor's initiative and the plan redesign. That reduction appears there, and then if we're going to look over here in a minute in three places, 17.10.10, .13, and .14, you'll see that reappear. 17.10.10, this is part of that, the increase in the benefit packages. .13 is the co-pays for the pharmacy and the ER visits, and also to use prior reserve fund from the budget expense on the 17.10.14. That was part of the changes that the governor had recommended to us in his package. This next item, 17.10.15, is a new item that the committee has added, and I'll read that to you. This says, the board shall contract with multiple statewide and regional vendors for any state health benefit plan offered in calendar year 2015. I know there was a lot of interest in that, so that's what that's in there for. Under the Georgia Board for Physician Workforce Graduate Medical Education, 17.12.3, this is to provide funds for 6 additional family medicine residency slots at Houston Medical Center. If you'll recall, this is the final year of the 4 for the startup of the osteopathic medicine residency program there in Houston County at the medical center. Under 17.12.4, this is an increase on all Georgia Board of Physician Workforce capitation residency grants by $333 each in state funds. There are 1,392 total slots across the state. Of those 1,392, 1,326 can draw down matching federal dollars 2 to 1, so that $333 will mean they'll end up getting $1,000 per slot, which will come to about $1.3 million total out of the 463 that we're going to put in to help them out. Next item is 17.13.1. This is to provide funds to increase the operating grants for medical education at Mercer. There's a $1.8 million grant there, increase. Next item is 17.14.1. This is for the Morehouse School of Medicine. We're adding $5 million to their operating grant there, which still allows them to draw down with the federal funds up to that $30 million number. And what this will do is the federal funds begin to not become very stable and maybe go away. This will help free up some additional upper payment limits through the Georgia hospitals to help go to that, where it'll help the GME slots, Morehouse, as well as the hospitals. And Morehouse is made whole by doing that. 17.15.1, this is to provide funds for loan repayment awards. This is where we were allowing the doctors to serve in underserved areas, and they were getting $20,000 as part of their loan forgiveness. This will bring that funding up to 30. Last year we only had enough money to do 17, but it had 37 requests, so this will help with that, $260,000. Drugs and narcotics, 17.18.3. This will provide for one additional post-certified licensed pharmacist inspector to help with the pill mills as well as make their other drugstore and pharmacy inspections as well. Under public health, 37.1.3, this is where the $225,000 shows up for CORE, the Georgia Center for Oncology Research and Education, because that's tobacco money. That's more appropriate that it be there. The next item, this committee's always had an interest in the 13.11.2. This is for funds for the fourth-year phase-in of the grant and aid formula to hold harmless for the counties across the state. This is the fourth of 7 years, $1.34 million to do that. Under the Georgia Trauma Care Network Commission, 37.14.4, there's a $1 million add with that. This is to help support the trauma center readiness cost and qualified uncompensated care. And members of the committee, that completes our recommendations, and we'll entertain a motion. We have a motion to pass and a second. Is there discussion? All those in favor say aye. Aye. Any opposed? Thank you very much.